Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Choking First Aid, presented by Betty Goodwin, Clinical Nurse Specialist with Washington Hospital Healthcare System. Betty Goodwin is the Clinical Nurse Specialist at Washington Hospital's Emergency Department. She has 30 years of experience caring for patients in distress, with a passion for helping patients experiencing interpersonal violence, including human trafficking. Today, she will be sharing her basic life support knowledge around choking and how to assist someone when this happens. Please welcome Betty Goodwin.
Hi everyone, thank you for coming. I really appreciate you showing up for what is a very important presentation today. Hopefully I'll answer your questions and make sure that you guys leave here with some important skills and knowledge to help when people are experiencing choking. So the first thing I just want to bring up as people were entering was the conversations I was overhearing about, I was choking, or I choked, or someone else was choking. So I hear that there's a lot of experience with that. And it's pretty important to be able to recognize skills for when people are choking, what to do, and once you're comfortable with that, or you feel like you know something about it, you're empowered to then do something for someone else, and potentially you could save a life. So I'm glad for those that are sitting in the room that experience that they're with us today, and I hope to give you anything and answer all of your questions. So the reason that we are doing this program basically is very near and dear to my heart and our community. And rather than tell you this whole story, we're lucky enough for that person to share their story with us. So I have a video that I'll play. Already need technical support. Okay.
Hola, mi nombre es Rico y junto con mi hermano Kiko, como pequeños empresarios, abrimos el restaurante Federico's Grill en el distrito de Nal, en la ciudad de Fremont. Un día normal, cocinando, después que termino de cocinar, me gusta siempre ir a la gente, a las mesas, y preguntarles cómo estuvo todo, la comida estuvo bien, el servicio estuvo bien, la atención, todo. Y esta mesa específica, le llego, son 4 personas, 2 capos. Y la señora, al momento que le pregunto cómo está todo, la señora me responde, todo está bien. Le digo, ok, está bien. Cuando volteo y miro al Señor, los ojos del Señor me dijeron algo. Y me detengo. Y le veo los ojos y le digo, Señor, ¿usted está bien? La señora nuevamente me dice, todo está bien, muchas gracias. Pero no sé, algo dentro de mí o los ojos del Señor me dijeron lo contrario. Y no sé por qué. Le dije nuevamente, Señor, ¿usted está bien? Y la señora me respondió por tercera vez, sí, estamos bien. Y sin permiso ni hablar nada, me voy detrás del Señor y empiezo a darle CPR, que yo no sabía en el momento, pero empiezo a darle sin saber, le doy en el pecho, le doy aquí, le doy por todos lados, menos en la boca del estómago. Y no sé, 20 segundos después, que parece nada, pero sin respirar, 20 segundos es mucho tiempo. Y respiro. Y fue mi suerte, o la suerte del Señor, que le di el sitio adecuado y el Señor escupió un pedazo de pan. Y me miró a los ojos y me dijo, gracias. Y me dio mucha alegría, me reí, me sentí un héroe en ese momento. Y no sé, pero era un héroe. Pero un año después, lamentablemente, mi querido hermano Kiko pasó por la misma situación y no hubo un héroe, no hubo una persona capacitada para salvarle su vida. Se ahogó y nadie lo pudo salvar. En su honor y para salvar vidas, junto con el personal médico de Washington Hospital, hemos querido brindar la capacitación para todas las personas de los restaurantes. Este entrenamiento hubiera podido evitar tragedias como la vida de mi hermano Kiko. Y es por eso que deseo traer para salvar otras vidas en nuestra comunidad. Muchas gracias por su fina atención.
Okay, so definitely a tear maker there, and how unfortunate. And it's unfortunate, and I totally did not know that people who are in the restaurants serving our food, they do not have to take any classes or training on either CPR or the Heimlich maneuver, abdominal thrust maneuver, to help people who may be choking. And I just found that astonishing, because I think I just assumed, which is a bad thing to do, but I assumed that they knew that already, and how unfortunate they did not. And one of our community members had to pass away to help us to get this word out to the community. So thank you for joining us for that. So I'm going to go over a few things that I think are interesting and answer a few questions. So I don't know how many people know that choking is the 4th leading cause of unintentional injuries in the US. And about 3,000 people die from this every year, so it's not a unique situation that this happened. And like he said, the year before, he had seen someone choking in his restaurant. So very common thing to have happened. Statistics from 2021 show that we have the death rate from choking about 1.6 per 100,000 people. It seems like a lot, especially if you think about maybe that's almost three to four people here in Fremont every year would pass away from choking. That seems like a lot for food issues or airway blockage. And elderly are a little bit more susceptible to choking incidents, and that being because most commonly they're eating food, socializing, their structures, their musculature is a little bit weaker and their airway is a little bit smaller due to the changes with aging. And so they are a little bit more susceptible to that. To prevent choking for everyone, you want to make sure that your food is cut in those smaller pieces, chewing it thoroughly before you swallow your food, and avoid talking and laughing while you're eating your food. And I don't know, food is a very social thing, right? So when you're eating your meals, aren't you talking and laughing and we have a good time? It's part of our culture. For infants and children, the same thing kind of goes. The small objects, you don't want them ingesting any of those little tiny Legos or peas or beans or things when they're too small to get them swallowed. You need to make sure that you're watching them while they're eating. Don't put something in front of them and turn around to cook your food, because when you turn back, they could already be choking and be in a problem. Going to see if we more technical difficulty. Okay, something happened. It came back. I don't know, it just went out and came back. I think I'm okay. Avoid giving high-risk foods. Things that are going to be too difficult for them to swallow would be like a whole grape. I know we've heard of cutting grapes in half. Nuts, and who here is choked on a hard candy? So that's one of those things where you think you're doing them a good thing by giving them a sweet, but it may get stuck in their airway and cause a blockage. And then for the older adults, make sure the foods are softer. They're in small enough pieces. Chew slowly and thoroughly, and just be aware that it may not be food at all. It might be medications. And as we get older, we tend to need more medications, right? But some of those pills are very difficult to swallow, and they do occasionally get inhaled because you start coughing and then it goes in the wrong pipe. So it may cause choking because of that. Also, the dryness, you need to make sure you're taking it with plenty of water. All right, so here's a good thing. How do you know someone is choking, right? The universal sign for choking, that throat, the hands at the throat. If someone is just coughing, they're having a problem with their food, they're coughing. Do we really need them to ask them to do the Heimlich at that point? No, because they're actually making air come out. They have a cough reaction, and so we're okay there. The sign of coughing when they put their throat up is they can't make any noise. There's no air coming through that voice box, so they're not able to speak. They won't be able to talk to you. Once they have their hands up, you should ask them, can I help you? Are you choking? And usually you'll get a nonverbal cue that it's okay to approach, it's okay to help them out, and they indicate yes with their nod. So what do you do? This maneuver is called the abdominal thrust. It's also been called the Heimlich maneuver, and it's a first aid technique used to treat anybody who is choking, either object, food, anything that someone has blocking their airway. So to perform that, a rescuer, which is yourself, would stand behind that person, and using their hands to create some pressure, you would take a fist, put that just above the belly button and right under the diaphragm, okay? On top of that, would go around the person and put that over the fisted hand. The maneuver, if I turn to the side, is a quick in and up. So you're kind of going towards your shoulder blades, right? If you're doing it on yourself. And that, what you're doing is taking the air in the lungs and using the pressure that you're putting to force that object out of the airway. And the pressure in the lungs, if you put enough quick pressure on it, should be enough or could be enough to get that piece of food or that pill or whatever object is stuck in there. Okay. The other thing you can do is if you're choking and by yourself, One thing to do is try to do this on yourself. You can bend yourself over the back of a chair in the same area that I just told you to do the fist and hand. And you can also make sure that you're dialing 911, right? Because you want to get 911 there. This is regardless if you're helping someone else or you're having to start doing this on yourself. In addition to adults, infants will also choke, right? And if you see them and they're becoming restless and you can tell that they're not doing well, you can do back blows, okay, or back slaps on an infant. The good thing with infants is they're very small, right? So you want to put their head down on top of your hands and arm and their face down and hit them on the back 5 times. Hard, okay, because you are now trying to get them to stay with you. So you want to hit them on the back, then you can flip them over onto their tummy and push on their chest bone, okay, 5 times. And doing that as you go to, if you can get yourself to the phone to dial 911, that's what you'd want to be doing. Hopefully that will enable the gravity to help you with their head down, and that object will pop out, whichever one that is. All right, I'm now going to demonstrate on a real person. I've picked a guinea pig in my midst. Hello, Angus. Thank you for being my person. All right, so one of the things I want to tell you is don't be intimidated for factors of difference in stature. If you're a shorter person and you've got a taller person, if that person can squat down for you and give you more of an angle, that's fine. If you need to have them lean over the chair while you try to do it, that's fine too. But we're going to try to do this with Angus and see if I can get him to not choke. So Angus, are you choking? Do you need help? Okay, turn around, Angus. Someone call 911, please. I would try to make my fist around Angus. I'm a bigger person and it's hard for me to get my hands around, so I may do where I'm pushing 2 hands. It's okay to try to augment it a little, but I'm gonna push in and up for Angus. Good, Angus. I'm so glad you're okay.
Thank you. I feel much better. Thank you.
Okay, the other point I want to make is, could I do that? I couldn't see. Oh, one more time, Angus. We got to go the other way.
Sorry.
Okay, so my hands, if I put my hands around, okay, I may not get all the way there. I might get somewhat there, but I've got to try. So it is right in here because you want to use those lungs. You can't be up on the ribs because then you're pushing the lungs. You're not being able to use them as a balloon, basically. So if for some reason I could not have gotten that out for Angus, what would happen is he would lose the consciousness, right? Because after so much time with no air, Angus is going to pass out. And if that happens, somebody should be calling 911, right, for you. But Angus would then go to the ground. It would then become CPR at that point. Okay, so I just want you to know that it's still something you can do for Angus if you cannot get that object out. There are times when the piece of object is too big, and it may be that you won't be able to get it out. Speaking from experience in the emergency department, we've had people come in with steak or something that's just too much. And so please don't feel like you're a failure if somebody ends up passing out on you. You're doing your best to help them with what you can, and that's the goal. So please try. If somebody needs your help, please try. Okay? Thank you, Angus. Well, at least you're not choking now. Okay, that's my demonstration. I wanted to show you it can be done. and empower you to be confident in your skills. Ask for help. If somebody doesn't know but you think they could do it better, maybe you don't feel confident, you can talk somebody through those skills too. You can show them just with two hands how to do it and where to put it.
Are you ready for questions?
Okay, I'm ready for questions.
All right, thank you, Betty. That was awesome, and thank you, Angus. We do have some questions from our Facebook audience, and after that, we'll take questions from our in-house audience. So our first question we have is, would it help me to try to drink water if I'm choking?
Some people have wanted to try drinking water. You can, but once you're choking, once it is in your airway, swallowing the water will not make it go down because it's not in your esophagus anymore. It's actually blocking the airway.
Okay, our next question. What is the most common food that causes choking?
I kind of had some slides on that, but the things that cause choking can be hot dogs for little kids that didn't get cut up into small enough bite sizes, leaving them big and round, candies that don't have a hole in the middle because they lodge there. And I would just say those bigger pieces of food, if you're not watching, can sneak up on you.
Okay, and our last question from our Facebook audience is, what things should you avoid if somebody is choking?
Well, definitely if they're coughing, you want to avoid doing anything at that point. Let them cough and try to clear it themselves. You're the best person to take care of whatever is in there if you are managing. Okay, so just stand by in case you need to help them. Once they stop making noise, most likely that's gone down into their windpipe and they're going to start having some distress. So at that point, that's when you should start to interact with them saying, may I help you? Are you choking? Do you need help? And that's kind of what I would say to get involved at that point.
Okay, thank you. Do we have any questions today here in the auditorium? Okay, start right up here.
You mentioned for kids hard candy that they could choke on hard candy.
Yeah.
Does that also apply to adults?
Yes.
Because I suck a lot of hard candy. So I was wondering, how can you choke off of a hard candy? Because every time when my mouth gets dry or I have a taste for a piece of hard candy that I always carry, now how can you choke off of a hard candy? That's my question.
Yeah. The hard candies, what happens sometimes in your mouth is it slides towards the back. So if you're sleepy, if you get too relaxed and you fall asleep in front of the television, if you're talking and laughing and all of a sudden it goes to the back, those are things that could cause that hard candy to kind of get in a bad position where your tongue would not be able to manage and get it out. And so sometimes what I say is if in doubt, if you think about it, just kind of tuck it in the side, because that way you're at least managing it and you can still have your hard candy and suck on it, but to just let it rest, I would put it to the side.
Because I'm also asthmatic, so I always carry cough drops.
Yeah, and that's fine. And most of the cough drops are also designed not to be completely round and too big, right? So you could probably get it down.
Okay.
Yes?
So you're with someone who's choking, you're trying to help them, it's not working at first, they lose consciousness. It doesn't help to continue to try to do abdominal thrust to try to get that out?
Well, they're not going to be able to stand. Once they've lost consciousness, they're going to pass out on you. There's no way you can continue to hold them up. It's impossible to hold them up while you're trying to do that maneuver. So yes, please ease them down to the floor, put them in a supine position with their face up, laid out, and just start CPR. Because at that point, you need to keep the circulation going. They probably don't have that.
Any other questions? Yes.
Do you have to be careful not to break their ribs?
Good question. The way I put it is, I would rather be alive with broken ribs than dead with somebody worrying that they were going to hurt me. It could happen. And I think we all try to be very careful as much as we can, but sometimes we don't know. It's very infrequent that you would probably break a rib because remember, you're kind of underneath that area of ribs. You're in the diaphragm, right above the belly button and under the rib cage. So yeah, I mean, if you do squeeze hard and they pop something, they can wrap their ribs up and they'll heal. But they won't ever come back if you're not trying. Yes, please.
Yeah, what would you do if there was a pregnant lady who was choking?
Good idea to ask that question. So pregnancy pushes everything up. You don't have as much air space in the lungs to get some good leverage, but you do have to go above the pregnancy, so above that uterus, and just do the same maneuver. It's a in and up if you can. Sometimes it's just going to be a straight back. Thanks for that question.
Do we have any other questions today?
Yes. You said 5 back slaps and abdominal thrusts for infants.
Yes.
Is there a number for adults that how many times you can try? Just like, is there a count or?
I don't think for an adult there's a count. Really, you're not gonna be pushing on their chest like an infant, the switching. So you can do some back slaps on an adult to see if that will work. But sometimes you have to, again, then go around to trying from the abdomen and using the air in their lungs. Yeah, when you slap them, there's no air, right? Okay.
Thank you. Any other? Oh, one more. Oh, got a couple. I'll be right back.
Thank you, Betty. I have a quick question. Have you noticed or have you heard of any tools that perhaps people can leave in their home in case this does happen, and if that thrust doesn't work? I've seen some things, like on TV and things like that.
As seen on TV.
Yeah, seen on TV. Yeah. Have you noticed any tools that could be effective that maybe perhaps people should have around their home, like having a fire extinguisher for a fire, things like that?
So I think there is a model, I don't know what it's lung vac or something like that. And it forms a suction. You have to get a really good seal on the mouthpiece, and then it kind of plunges in like a plunger would be. And when you let it go or pull on it, then it supposedly creates some suction to get that object out. I think I would use that as a last resort. It seems very difficult to use. I've tried to position the mouthpiece and do that. It's hard to use. And also when you push the plunger, I'm kind of scared if you're not using it in the right way, that you might actually push the food down. So I caution everyone on that, but then again, if you feel like you have to have something and that's what makes you feel confident, then try the Heimlich maneuver, try that. Your definitive answer is to be dialing 911 either way.
Thank you. We have one more question here.
I'm concerned if you're alone, the matter of panicking. Do you know anybody who's actually come into emergency that has helped themselves if they were alone?
Yes, I do. They also called 911 first, knowing they were choking. They couldn't say anything, but 911 will send someone out when you can't talk to them. So that was that person's good decision to call. But you can put yourself over the chair, like your kitchen table chair, over a counter, anything that gets you some pressure here. And yes, it does happen. That has come into our emergency room where somebody has come with a piece of food that was very large. They said what they were doing is they were talking, and they took a breath and it just got sucked back in, and we checked them out. They were fine. They got to go home. Yeah.
How does the 911 people know when you can't talk to tell them that I'm choking?
Yeah, they make sure that you are that you're calling, right, for an emergency. And when they don't get a response, they usually send someone out, right, to check on you. Yeah.
All right, thank you, everybody. Good questions. And thank you, Betty, for this insightful presentation. We appreciate you taking the time to be here with us today. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.